It's late this evening, but we are live. Cosi Talks live Wednesday night, 8:30 p.m. or 8:37 p.m. My apologies. For those of you catching the replay right now, thank you for watching. Please let me know you're watching the replay. So you can just do that by either giving me a shout out in the comment section or putting replay in the comment section. Also, if you have any questions, those of you watching the replay, please put them into the comment section as well. I do like to look back and see who is watching and pick up any of those questions and answer them for you directly. So we've got lots of questions that I picked up this week for tonight's show. So I'm going to give you guys a couple of minutes to jump on board. I know I sent out the text reminder message, and I'm excited because I know many of you have been subscribing to the texting service that I have, and I'm going to give you some more information on that very shortly. So we're going to go ahead and just wait for you guys to get started. I'm just typing out my last minute notes and be able to get going. All right. So who we got on board? We got Benny listening in from Texas, and Benny is listening from the YouTube channel. So guys, you can also catch me on the YouTube channel as well. Hang on, I'm making sure I got everything here, all the details there, because I know some folks are not real friendly with the Facebook, and sometimes Facebook makes it a little tough to find my show. So Cosi Talks under the YouTube channel, very easy to find me. We've got Harsh on board, we've got Mary Ann, and you got the message. Yay! So Patrick, hey Liz, thank you guys for letting me know that you got the message. Let's see. So let's see who we got. We got Phil coming in from Canada saying he's sipping on some aqua. Love it. So guys, lift your glass. Cheers. I'm going to get started. All right, I need a full glass tonight because we have that many questions coming in. Hey there, Pastor David. Good to be here. Good to see you here again, too. All right, guys, I'm going to give you guys another minute. We've got Jerry Ann coming in from Arizona. Thank you for watching. We're going to have hopefully a lot of new viewers tonight, guys. A lot of folks have been saying that they're going to come watch the show for the first time. So I'm always excited when we get some new folks on board, get some new blood on the show to help spread the word about what the show is and what it's about and how it's meant to help this community. All right, guys. So we've got a nice little group on board. I am going to go ahead and get started. For those of you who are watching for the first time, welcome. My name is Cosi Belloso. I'm a physical therapist, amputee specialist here in Tampa, Florida. We are having some of the most beautiful weather in Florida. As you can see, I've got my Valentine's Day roses sitting here just to make me smile right here. Aren't they pretty? I know, my husband's so sweet. All right, guys. So for those of you who have never watched this show, let me just tell you a little bit about the background of the show itself. I opened up a private outpatient practice here in Tampa 5 years ago. It's been 5 years now, and the practice is called Palanca. It's meant to help amputees in learning how to get ready for their prosthesis, how to walk with their prosthesis, and in some cases, how to run with their prosthetic devices. So right around the same time that I opened up my clinic, I started kind of going on Facebook just to let people know that, hey, I was open and available to help with my services, my physical therapy services. And I started noticing on the support groups that a lot of folks were asking questions, and they were very basic questions that as clinicians, we should be answering. So I started answering questions, and one day I accidentally hit the live button, and that's how this show started. It started with an accidental pressing of the live button. As you could tell back then, I was not very Facebook savvy. So that's how things got started. So 5 years later, I am still broadcasting every Wednesday night at 8:30 p.m. Eastern Standard Time to an amazing audience. And I've had wonderful support from community sponsors in the O&P industry and some amazing special guests. So guys, next week, okay, those of you who are new to this show, you are definitely going to want to tune into next week's show. I am bringing Integrum on board. It's a company that is the maker of the Oprah bone anchored prosthesis. Now, if that sounds a little bit complicated, let me simplify it a little bit more. So it's a popular term known as osseointegration, right? So we've been hearing that buzzword a lot the past few years. So they are going to be coming on the show next Wednesday, right? Kurt Collier, amazing prosthetist. He's the vice president of prosthetics for Integrum. We're going to be coming on the show to talk about the Oprah bone anchored prosthetic system. So their version of how they use osseointegration to allow for a prosthesis to be fit onto the leg. And guys, it is full of so much information. Like my presentation right now, we're sitting at 6 pages of just notes of all the information that we're going to be bringing you next Wednesday. So guys, get your phones. Like I set a ton of alarms on my phone. I have 4 kids, so I have to set alarms on my phone for everything for my day so I don't forget stuff. Set your alarm on your phone for 8:30 next Wednesday because you do not want to miss next Wednesday's show. So who we got here? We got Eric coming in with his Pepsi Zero. We've got Jenny coming in from Utah enjoying her chai tea. We got Johnny V. Thank you so much, Johnny, for joining in and for all your support that you've been giving me these past couple of weeks. Really appreciate it. All right, guys. So I had a lot of questions that I picked up from the support groups this past week that I've been kind of going through the support groups. So for those of you who are new to the show, let me just explain how it kind of works. There are so many different ways that you can contact me. Through my Facebook channel, through Instagram, through YouTube. And guys, everything is under Cosi Talks. Super nice and simple, right? You can even email me directly, and I'm going to put that email there in just a moment. Guys, feel free to contact me directly and send me your questions. That is the whole point of this show. That is the whole reason behind why I do what I do. So for those of you who are new and maybe you're just a bit shy and don't want to put your question in the comment section here live, you can send me your questions privately through any of those channels. Next thing I'm going to bring up, because this has been a really wonderful tool for me the past couple of months. So I just put up there a phone number. Okay. I started a texting service. So every Wednesday night, I send out a text reminder, hey, I'm going live. And then I put the links in that text message to make it easy for you guys to find me. Okay. I promise I don't spam. So if you want to join this text list, text Cosi Talks, just the way I have it written there in all caps, one word, to that phone number, and you'll start receiving my text messages. And then the cool thing is you can actually text me back, and I can see those messages as well. So you can text me your questions from there. Yes? Hey, Chuck is in the house with his iced tea. All right, guys, let's go ahead and get started with these questions. So here's one. Oh, I'm going to save that one for later. Here's one. Okay. So this person asked in the support group, are knee scooters a good thing for below the knee amputees? Those of you who have watched my show are probably going to be able to guess what I'm going to say. No. I have to say, guys, I am not a huge fan of those scooters, even with like non-amputee orthopedic injuries. They kind of make me cringe just a little bit. I know that for like some folks, it's a lot of fun because they can go whizzing around on these one knee scooters. Do you guys know what I'm saying with these one knee scooters? It's basically where you're kneeling on like a little scooter with one leg and you're propelling with the other leg. So it's kind of like a half scooter, half skateboard situation, right? And your injured leg is the one kneeling on the scooter, right? And I see people use these all the time. And I got to admit, it makes me cringe just a little bit. Number one, these scooters are really tippy, right? You see these people like careening around the corner and they look like they're about ready to tip over. And I've seen it happen where they tip over. So from a safety standpoint, it's like, oh, it's a little, not very well balanced. But even more important than that, okay? Whenever you're placing your knee in a flexed position, and that's what happens, you're essentially kneeling on this scooter, right? Your knee is in full flexion, okay? Even for someone who doesn't have an amputation, you're going to run a really high risk of getting a contracture. And we've talked a lot about contractures on this show. And that's basically where your leg gets really tight and it gets stuck. Okay. So, and that's for someone who doesn't have an amputation. So for those of you who are below the knee amputees, you already have a much higher risk for a knee contracture. And then if you put that knee onto a scooter and you're scooting around all day with your knee bent like that, it's pretty much a guarantee you're going to get some form of contracture there, right? Uh, there's my OT right there. I love it. I knew somebody was going to jump in. Andrea was like, no, resist the knee scooter. Lousy for turns and getting in the bathroom. Oh my gosh. Yes. These things are like, they're big, right? I mean, they're not big in the sense like a wheelchair is bigger, but they're still cumbersome. And like getting into a bathroom and turning around, kind of a hot mess. And I know I'm going to have some people who say, well, I like using my scooter and, okay, I get it. But again, this is the PT clinician perspective. And it's not just about the safety of actually maneuvering. It's this knee flexion contracture, guys. And knee flexion contractures can pose a real big problem when it comes time to start learning how to walk with a prosthesis. So let me just talk a little bit about what that looks like. Come here, Bob, you're on. All right. So for my below the knee amputees, right, knee flexion contracture means that you are not able to extend your knee all the way straight. Okay. So even a contracture of 10 degrees, which is about that, doesn't seem like a whole lot, but that's going to impact the way you walk. Okay. And again, if you're on a scooter, right, think about it. Look how much you're bending that knee. You're bending it at 90 degrees. Holy cow. Right. And if you don't think it's going to get tight, it's going to get tight. Okay. Our legs are meant to be like this for most of the day, like upright with gravity taking effect, pulling down on these muscles, on the muscles in the back to prevent them from getting tight. Right. So if you're missing the lower part of your leg and that part's not holding that down, and then on top of that, you keep your knee like this, yeah, no bueno. You're asking for a lot of trouble there, guys. Okay. So, what are you supposed to use? Right. And you're like, okay, well, if you're taking away my scooter, Cosi, then what is it that you want us to use? I prefer a good old walker, good old fashioned walker, or in some cases, crutches. And I say in some cases because crutches are also like, they can be a little scary to use if you don't have good balance. Okay. So those are the options that I prefer to use for assistive walking devices. And guys, let me take this moment. I'm going to put my little PT plug in there. Okay. The person who should be prescribing your walking device, anybody want to guess who it is? Who is the person on your clinical team who should be prescribing your walking device? That's your Jeopardy question. Let me see what kind of answers you guys come up with. Let's see. We got David Donahue from South Carolina with his green tea. We got Michael Broderick with hot cocoa. Oh, it'd be so nice. It's warming up in Florida. I'm going to have to squeeze into my last hot cocoa. Marianne said, it took me forever to heal. So my daughter got me an eye walk when I was a BK and I used it for 6 months until I healed. Hey, compadre, glad you could join us. Hey, Chuck, glad you're here. Hey, Tom. So we've got a couple of guesses coming in. All right. Liz is guessing PT. Michael Broderick says PT. Your PT. Yes, guys. Your physical therapist is the one who should be prescribing your walking device, whether that's a forearm crutches, also known as Lofstrand crutches, whether it's your axillary crutches, the one that goes under your armpit, whether it's a walker, whether it's a walker with wheels, wheelchair, right? Physical therapists are the ones who should be making that decision. Yes. Raise your hand and repeat after me. The physical therapist is the one who is making that decision. Okay. I can't tell you how many times I've had a patient come to see me and they have the wrong assistive walking device. And it was prescribed to them either by their well meaning doctor, their well meaning prosthetist, or somebody else who is not a physical therapist. Okay. Problem is safety, number one. If you're using the wrong walking device, you're going to possibly be more at risk for a fall. Okay. Number two, insurance. Many insurances will only reimburse for one assistive walking device. So if you get ordered the wrong one, you're out of luck and you're going to have to pay out of pocket for that next one that you might really need. Okay. So I always tell people, please, 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 please try to hold off until you talk to your physical therapist as far as which walking device you should be using. Okay. And there's sometimes where folks will come into my clinic and I'm like, just by looking at them, can't tell what they're going to be good at using. So I have them test the devices in my clinic. We always have a walker and a set of crutches, and we always have a set of something or other. Right. And I'll test them out on different devices to see which is going to be the device that keeps them safe and gives them the most amount of independence. Yes. I love it when people are getting all these answers. Yes. Jerry Ann, the PM&R rehab doctor is the one who actually writes the script. So they're the ones who actually write it down and sign that script. The person who makes the recommendation as to what they need to use, physical therapist. Physical therapist. That's part of our job, is to assess and prescribe appropriate assistive walking devices, right? And then my good friend, the peanut butter to my jelly, my occupational therapist colleagues, they're the ones making the prescriptions and the recommendations for all of those other devices, right? All the other devices that you use for ADLs, for your assisted activities of daily living. It's been a long day, right? So the OTs are the ones making those recommendations. And this can be things such as hand devices that you use to help you put your clothes on, right? Those of you who have issues with your fine motor skills, right? And have trouble with buttons or trouble with zippers. Okay. This can also go as far as devices that you use in your bathroom to help you get onto the commode, to help you get into the bathtub. Sometimes the PT and the OT might cross over on those recommendations, right? But this is what we do. This is our bread and butter of our profession. So we're the ones that should be making these recommendations, right? All right. Let's see. Thomas says, where do you go to get your assistive devices? Most O&P clinics do not carry them. You're right. They don't carry them because, once again, they're not the ones who should be making those recommendations. Okay. All due respect to my prosthetists out there, but the PT is the one who should be making these recommendations. You have the DME equipment store. So DME stands for durable medical equipment, right? So this can be it's usually dictated, Phil, through the insurance here in the United States, right? So typically, your PT makes the recommendation, the doc signs off on the prescription, right? And then you put that order in. Every PT or every doctor will have a durable medical equipment company that they might be working with and they might refer you to. Or in some cases, for example, we have this great mom and pop pharmacy that I like to refer people to help support small business, right? And I send my patients there and I say, hey, go ahead and order your durable medical equipment from there, take your prescription in, and they can help you with Medicare or whatever insurance that you're using to help get that reimbursed and get that approved. Okay. Now, there are some cases where you can buy directly off the shelf, right? Especially if you've already been assigned a walking device and your insurance won't cover another one. And again, that happens a lot. There are several companies in your area that you can buy directly from. Okay. Okay, so Phil asks, I am left above knee, just had surgery on my right foot using partial weight bearing on my right heel. Would an I walk knee crutch work for me? Okay, I'm not super thrilled with the I walks, anything that makes your knee go into flexion. If I'm thinking of the right one, guys, if it's the kind where you kind of put your knee into it and your knee is in flexion, again, not a huge fan because you're going to run into issues with contracture and tightness. Okay. So, Phil, this is again where working with the physical therapist can help you determine what is going to be the safest device for you. Okay. If you are someone who is really independent with your left above knee and you put a lot of weight into that, right, and you're pretty confident with that, perhaps using a walker, okay, and making sure that you're really strictly observing those partial weight bearing guidelines for your surgical foot because you don't want to mess that up, right? When an orthopedic surgeon tells you partial weight bearing, they mean partial weight bearing. And what does partial weight bearing mean? It means you can put 50% of your weight on that foot. Okay. So if you had surgery on your sound leg, right, which is usually in most amputees the dominant leg, okay, you've got to be real careful that you follow those weight bearing precautions. Okay, Phil. So in some cases, I've had folks that they were not able to really utilize their prosthetic leg and make it their dominant leg while they were recovering. So they temporarily had to use a wheelchair to make sure that the surgery healed properly. Okay. Because I can imagine if you went through that surgery, you don't want to have to go through it again, right? You want it to heal right the first time. So again, work with your physical therapist, have them look at you while you're doing that gait training with the partial weight bearing and make sure that you're observing that partial weight bearing recommendations. Okay. So Michael says, going in Friday to receive my new sleeve and get casted for my next socket. The downside now, I'm a right above the knee and lost motor function in my right glute and hip flexor muscles. Ooh, so my right leg just dangles and flops. Which exercises in your book could I prioritize at home to maybe add some resistance to my leg? So, Michael, can you just kind of give me a little bit more background? Okay, here. With my current entry prosthetic, I have to walk with a walker with majority weight on my arms. Hopefully, my next custom prosthetic will allow me to get a cane. Okay, so Michael, just kind of a quick couple things there, right? So, your socket is not going to be what determines whether you walk with a cane or walk with a walker. Okay. It's the strength, it's the balance, it's the coordination, and it's the proprioception. Okay. So, Michael, if you are just starting out, okay, if you are just starting out and you have my book, hang on, it's like buried. My books are buried right now. All the Valentine's Day candy and cards that I have here. Okay. Let me make sure I got the right book. Okay. So, the above the knee book, right? So, Michael, what you're going to want to do is you're going to want to go to, let me make sure I got the right place. You're going to want to go to the balanced section, okay? And it's towards the back of the book. And you're going to want to start off with the weight shifts, okay? That's where I start off all of my patients, whether they are beginner, intermediate, or advanced. I always start off with the basic weight shifting um, exercises, especially when there's new componentry. If you have a new socket, a new knee, a new foot that you're using, okay, these are great exercises, foundational exercises that you can use to start getting yourself used to it, to start putting the weight into that prosthetic side, to start activating those glutes. Okay. So, Michael, when you're talking about strengthening a muscle, it's not just pile on the load and pile on the weight and more is better. No, you have to lay the foundation for that muscle strengthening, right? First part of it is getting your brain to recognize that, hey, we need to start recruiting more muscle fibers, right? And give those chance for those muscle fibers to kind of wake up a little bit, right? Because of the surgery that you had, a lot of those fibers ain't doing a single thing, right? And your brain is recruiting just enough fibers to kind of work, but not really do the work that it needs to do. So when you do things like these weight shifting exercises and forward to backward, side to side, diagonal planes, following the directions that are in that book, you're starting to wake up those muscle fibers. You're starting to wake up those glute muscles, right? And not only are you waking them up, you're teaching them how to work together. And that's probably even more important than how much strength you can put into those muscle fibers, right? Teaching these muscle fibers how to work together. Okay. A lot of people like to skip steps. They like to go to the more aggressive exercises. And then later on, they go, well, why am I having trouble walking? Why am I having trouble getting off the cane? You got to set that foundation down. And Michael, if you have the video subscription to my program, listen to those videos as well, because I do talk a lot about how the importance of these foundational exercises. Okay. So I hope that helps, Michael. And guys, let me just go ahead and put this down. Mhm. Sorry, I need to. Okay. So um, the book and the exercise program that I've got that I'm talking about right now, it's the link is right there. So it's got 150 exercises for above the knee and below the knee amputees. It's got exercises for arm, leg, core strengthening, balance, and flexibility. Right. There's a book for above the knee and there's a book for below the knee where it has all the exercises and pictures written out, all the instructions, all the education that you guys know I love to put into things. It's all in that program right there. So if you haven't had a chance to go check it out, you can go check it out there. And on that main page, if you scroll down, there's like 5 sample exercises that you can watch the videos to see what it is that I do and talk about on there. Okay, so there we go. Mhm. Let me scroll through, make sure I got all these. Hey, Daniel. Um, so Marianne says, I had to go to the basement to use my wood stove and iWalk work well for that. Guys, look, when it comes to the iWalk, as a clinician, it's like that rolling scooter. I cringe just a little bit, but I do hear so many people who say, wow, it really helped me while I was waiting to get my prosthetic device, while I was waiting to do this. It helped me get around from point A to point B. So at that point, I just go, okay, if it gets you up and it gets you moving and you're safe while you're doing it, okay. But as a clinician, I got to go, not a huge fan because again, you're bending that knee. So I need to learn a little bit more about that device, but again, what I've seen about it so far, it's not usually my first recommendation. Mark says, I am a left above the knee amputee. How do I protect my sound side? That's a really good question, Mark. I don't know if I've ever had it phrased quite that way. So the important thing about protecting yours is exactly that, protecting your sound side. Okay, so what does that mean? So when you guys start learning how to walk again, obviously you're going to probably favor the side, the sound limb, the anatomical limb, the limb that's still intact, however you want to call it, right? And it's only natural to lean more on that side, right? It's scary to have to lean on a prosthetic leg and put your weight fully into it, especially as an above the knee amputee, right? And having to trust that that leg and that foot are going to be underneath you. Okay. So, Mark, early on in all of my patients, I really drill into them weight shifting. I really drill into exercises that are going to pull the person into the prosthetic side to get them to start trusting that socket. The more they use their prosthetic side, the easier it's going to be on their sound limb in the long run. Okay. I have a lot of folks that they didn't get the proper therapy, right? And they started walking and walking and walking. And maybe not right away, but years down the line, they start getting a lot of these chronic overuse injuries. Arthritis starts to become a problem on that sound side, right? Issues that require a hip or a knee replacement on that sound side, right? The back, that's another big one. I think it's a crazy like 80% of amputees within the first 5 years of amputation develop low back pain, right? So if they're not using the right mechanics and not learning how to really put their weight into that prosthetic side, all of these issues start to crop up. Okay, so Mark, that weight shifting exercise that I just showed right there, again, that weight shifting exercise really does a lot to help protect your sound side because it gets you to start trusting the prosthetic side, right? And it's a very simple exercise that can be done in your home. When I worked home health, I had my patients do it all the time on the kitchen counters, right? So they would use like a kitchen island and a kitchen counter as their parallel bar so that they could lean with upper extremity support. So it's a simple exercise. It's a relatively safe exercise that can be done, and it allows your brain to start really processing all this information. And it does so much. Like I said before, it starts waking up those muscle fibers in the hip, makes those glutes start working, right? It starts to waken up that sense of proprioception, meaning the ability to know where your body is in space, right? And it gets you to start trusting that prosthesis. So, Mark, if I had to pick one exercise, I would say it's those weight shifting exercises that I do with my patients. Um, okay, so Michael says, I'm 15 months at home, nearly 2 years since my amputation. My PT has me in therapy, standing on the sponge pads, waving around low weight dumbbells, and walking with a walker in the room. I've maxed out at 1,200 feet. That's really good, Michael. That's really, really good. And the fact that they have you on sponge pads, kind of waving around dumbbells, that's a really great challenge for your balance. It also really helps activate that core and make it nice and strong, which is what we really need as well when using a prosthesis. Um, so, what I'd be curious to know is why you're still using the walker. I know you mentioned that you still have a lot of glute weakness. Was there neurological injury? Did you have a nerve injury to any of those muscles? So, if you don't mind including that information, um, just to see. Oh, Mrs. Mikatinik. Oh my goodness. I can't believe you're watching. Thank you so much, Mrs. Mikatinik. Michelle, I appreciate that. I have to say my sister-in-law was the one who gave me this outfit. So she keeps me looking good. She keeps me looking good. Thank you. All right, we've got this question coming up. Oh, now that I have a lot of you on board, this is why I was saving this question because I want your opinion on this one, guys. So, like I said, I've got a lot of new folks watching the show tonight, right? Some of these folks are um, looking at having an amputation done in the next few weeks, right? And y'all can remember back to what that must have felt like knowing that you were going to have your leg amputated. A lot of fear, a lot of anxiety probably associated with that. And a lot of it is the fear of the unknown. Okay. So whenever I see someone on a Facebook page saying, hey, I'm getting ready to have my amputation, what can I expect? I usually try to kind of tag that person and invite them onto the show. So if any of those folks are listening tonight, okay, this person asked, I will be having my right leg amputated above the knee in the coming weeks, and I'd like to get everyone's opinions, tips, and tricks that help them to prepare to transition after the surgery. Now, this particular individual is a cancer survivor. So, unfortunately, the first treatments that she did to remove the tumor and to get rid of the tumor with chemotherapy were not completely successful, and the tumor came back. So now she's looking at having an amputation done to make sure that she can be cancer free. So you guys know I have a soft spot for cancer survivors, and we have quite a few of those cancer survivors on this show, which is very unusual because cancer usually only counts for less than 2% of all amputations out there. But for whatever reason, we have a lot of those on the show. So if this person is listening in tonight, I hope that she can benefit from some of the advice that you all can give her. So guys, if you had to give one piece of advice to someone who is looking at having an amputation done and they're facing down the barrel of that, what would be the piece of advice that you would give them? And start putting that into the comment section, guys. And while you're doing that, Val or Chuck is asking, so a 3-foot parallel bar would work for the standing exercise? Oh my gosh, yes. And if you happen to have a 3-foot parallel bar in your home, that's kind of awesome. Guys, I can't tell you, I worked home health for 8 years. Whenever I would walk into someone's home and they had parallel bars built in their home, it would make me so happy. It would make me so happy as a PT because I was just like, oh, they brought a clinic to your home. How lovely. And it just makes it so much easier to do these exercises, right? But guys, if you don't have parallel bars built in your home, that's okay too. Okay. The home kitchen counters are beautiful parallel bars, and there's so many different ways. And again, those of you who are receiving home health physical therapy, that is a resource, that is a thing, right? You can ask that physical therapist to help you kind of, I used to kind of joke around saying, I'm feng shuiing your home, right? Position your kitchen in a way that you can do your exercises in the kitchen or the dining room or maybe even the bathroom, depending the size of your bathroom, right? But usually my favorite was a kitchen countertop, and I would put a good chair behind the person. And that way, if they got tired, they could safely sit down in the chair to rest in between their exercises, right? We got Jill coming in from Berkeley. Mhm. Okay, so Jerry Ann says, I can't seem to get an answer about the tibia bone hurting when I put on my prosthetic. I'm a bilateral amputee and I haven't walked yet. Just tried on the left leg prosthetic once so far and it bled. I am so sorry to hear that. So you are a bilateral or double below the knee amputee. Okay, so here's what Jerry Ann is referring to. Quick little anatomy lesson, right? So is like I said, guys, long day, right? All right, so we've got this bone right here, the bigger, thicker bone. Some you know people refer to it as the shin bone. That is your tibia, and this little one right here looks like a little chicken bone on the outside. Is called the fibula, right? So with your below the knee amputation, you're cutting through both bones, and probably one of the bigger obstacles that you encounter when you're a below the knee amputee when it comes to prosthetic fitting is that tibia bone right there, that shin bone. Okay. The reason why, I mean, think about it. If you look at your leg right now, right, it's sitting right there. It's a very superficial bone. There's not a whole lot of muscle that covers over it, right? Not like the back part of your leg that has all the juicy calf muscles, right? So your tibia is just sitting right there. And then as a below the knee amputee, when the swelling starts to go down, and all those muscles start to atrophy even more, that tibia bone becomes very pronounced, and it looks like it's sticking out, right? And a lot of times folks are kind of like shocked by that. They're like, oh my gosh, what's going on with my leg? Unfortunately, that is a normal part of the process. Okay, and yes, it can present with a lot of issues when you're being fit for a prosthetic socket, and usually that little tibia bone likes to poke and cause problems with skin irritation. Okay, so, Jerry Ann, when you are a bilateral amputee, right? And if you tried on just one side and stood up on that one side, that's a lot of weight. Okay, so that's all of your body weight going into that one residual limb, right? So it's going to probably lead to some skin issues, especially if you were not using a wearing schedule. Okay, so let me just back that up just a little bit. So when I have patients who come in for the first time, right, and they're brand new to wearing their prosthetic devices, I'm very careful about how long they wear these prosthetic legs. Okay. I look at the person's skin. Do they have sensitive skin? Do they have any hot spots? Right. Because it's not just a matter of popping your leg on and keeping it on for 8, 10, 12 hours in those first few days. You have to gradually increase the wearing schedule, the amount of time that you wear that leg, specifically to prevent skin issues from happening. Okay. You don't want to see blistering. You don't want to see calluses. You definitely don't want to see bleeding. Okay. These are all red flag signs that your socket is not fitting well and that you're being too aggressive with the wearing schedule. Okay. And Jerry Ann, this is where you really, really, really have to advocate for yourself. This is not okay for there to be skin breakdown. So you need to always constantly communicate with your prosthetist and letting them know, you know what? This is not comfortable. This is painful. Right. Another thing, Jerry Ann, and maybe you can put this in the comment section for me. Did they cast you one at a time or did they fit you for both legs? And did you start the process wearing both legs? If you can give me a little bit more information, it might help me kind of guide you there. So Michael says, I broke my pelvis on both sides in the accident. My right side only has sensory nerve, not motor function. Okay, I will DM my x-ray. My atrophy and struggle to activate those muscles has really affected my ability to get a cane. Okay, Michael. So that is a little bit of a different story. When there is nerve damage to the muscle, okay, that means that nerve is not sending those impulses. It's not sending the message to the muscle to contract. So there may not be an ability to contract at all with some of those muscle fibers, and you're going to have some limitations there. Okay. So I'm sure they've probably done what's called an EMG study, electromyography, and it basically just tests to see how much of an impulse is going through that nerve, right? Just to see what you got. Okay. Um, in your case, Michael, if you're missing a lot from one side, then really focusing on strengthening the core, focusing on strengthening the glutes on the other side, that's going to be your focus right there. And it's not to say that you don't continue to try to strengthen the muscles that have some nerve damage, because if there's even just a little bit of a nerve impulse going through, if you even have just even what we call a trace contraction, right? Then you want to try to, get those muscles to keep working, right? Here's the caveat, right? When you have a muscle that has nerve damage, you don't want to overdo it, because then you can actually stress it out even more. Okay. So, again, Michael, this is where your physical therapist needs to be your best buddy in helping you figure out which exercises to do, right? And to what degree, how aggressive can you be with these exercises, and making sure that everything else, all the muscles all around that, are strong to kind of take up the slack for that support. Okay. Let's see. Elaine says she's a right above the knee and also a cancer survivor. Rhabdomyosarcoma. Oh, good heavens. I can't pronounce some of these right now. A sarcoma survivor. Thank you for sharing, Elaine. Mark says, I have a lanyard socket and I'm now using multiple ply socks. How do I know it was too much or too tight using socks? I'm going to get back to that in just a minute, Mark. Hmm. Here, I like this one. So Tom says, for the person who's expecting an amputation, my advice would be to acknowledge your feelings and don't be afraid to ask your caregivers any questions whatsoever. Okay. And guys, here's another thing. For those of you who are looking, let me see if I can get this link. This link right here. Those of you who are new to being amputees, those of you who are facing an amputation, I just put the link up there now to the Amputee Coalition Certified Peer Visitor Program. Okay, so the Amputee Coalition is a nonprofit organization. It's basically the representation for amputees in the United States, right? It's a fantastic organization. And they have a lot of programs, a lot of resources available. My personal favorite one is their Certified Peer Visitor Program, that and the conference that they have every year. Okay, but when it comes to the Certified Peer Visitor Program, guys, if you click the link and you contact them, they will put you in touch with another amputee in your area, okay, who has gone through training, right, to be able to help and counsel you through this time. And they even try to take it a step further. They try their best to match you up with somebody who is the same gender, somebody who has a similar amputation, even sometimes similar age, if they're able to do that. Okay. Because obviously you want to relate as much as you can to someone when you're going through a crisis like this. But I have referred, I don't know how many people to the certified peer visitor program. And it's been a wonderful, wonderful program. And I know I have some of them up on here listening right now. So let's see where some of the. Okay. So jumping back to Jerry Ann, she says only one prosthetic. They haven't done anything with my right leg because my left leg was amputated last January, right leg last April. So balance with one prosthetic is horrible. I agree, Jerry Ann. I agree. Even for someone who's a below the knee amputee, it's not, the balance is terrible. And it's also a lot of stress that you're putting into that residual limb. So, again, depending on the case, and I'm playing Monday morning quarterback right now because I can't obviously see you in person. But I guess I would have a conversation with your prosthetist to see when you can expect to get that second prosthetic fit. Okay. Because again, you might be doing more harm than good by trying to walk on that one prosthetic device. You're going to be, especially if you're a brand new amputee and you've never done this before, that's a lot of stress. Jerry Ann, I will say there are some very few times where I've heard of someone who's a bilateral below the knee amputee. They had surgery on one of their legs, so they only have the use of one prosthetic side, and they use that prosthetic side just to transfer, right? Just to move from one place to the other as they're healing, right? But just walking on that one prosthetic side unilaterally, that's a lot of strain on that leg. That's a lot of strain on the knee, hip, that's a lot of strain. So I would have a conversation with your prosthetist and just ask, okay, what's the timeline here? When is it going to be time for me to be fit for both prosthetic devices at the same time? And then you really need to be working with a physical therapist during this time as well, Jerry Ann, because what they can be doing in the meantime is providing you strengthening and pre-gait program. Okay, you don't see that as much as you used to, and that's not a good thing, right? It used to be that you could get a pre-prosthetic gait training program. Okay. And you would spend the time focusing on strengthening those important muscle groups to get you prepared for that prosthetic device. So I'm kind of throwing everything in the kitchen sink at you, Jerry Ann, but I want you to be able to advocate for yourself. I want you to be able to ask these questions to your prosthetist, ask these questions to your physical therapist. That's who really needs to be helping you with this process as well. Okay, let's jump back over here. So Johnny says, as a person who's had a synovial sarcoma cancer diagnosis and required to give permission to have your leg amputated, it takes a lot of strength and acceptance in order to transition through it. Seek out amputee peer support from a certified peer visitor or support group immediately and call the Amputee Coalition to help you find it. Thank you for posting that number up there, Johnny V. Thank you. And guys, these are wonderful people who have been through it. They've been there, done that, gotten the t-shirt, right? It's not a physical therapist clinician. It's a person who is an amputee, right? And no one's going to be able to relate going through this as much as someone who's already been there and gone through it themselves. Pat says, what to do prior to your amputation. Do a little research and line up a PT that has experience working with amputees. Thank you, Pat. PT is absolutely essential, and getting one who is experienced with amputees is an added bonus that may very well speed up your recovery. So Jody is a certified peer visitor. Jody, it's so nice to have you back, and I'm so glad that you're feeling better. Thank you for coming. Jill says, I like that, Jill. She says, accept the amputation in exchange for having a longer life. I had your exact cancer and exact problem. I went to live in rehab therapy for 2 weeks, and I'm working hard to get my independence back. So Jerry Ann says, agree. I'm working with a PT to strengthen right now, and I need to get your book. Okay. And Jerry Ann, guys, let me just go ahead and type in I mentioned it before. Here is my email address, guys. So feel free. I answer my own emails within 48 hours. I'm finally caught up. I was behind the past few weeks because I had some stuff going on with family, but I am finally caught up. So here is my email, my direct email. Any questions that you have, if you're shy about asking me a question live on the show, I'm happy to maintain confidentiality there. If you have any questions about the Strong Body book, if your clinician has any questions, I do get a lot of those questions, guys. There's not a lot of PTs out there who specialize in working with amputees, but there's a lot of great PTs who want to help. So if you have one of those physical therapists that perhaps does not have a lot of experience, they are more than welcome to reach out and ask me questions themselves. I had actually a couple of meetings today with a couple of different PTs from around the United States, just helping them troubleshoot some of their cases. I love doing that. All right, here we go. I have so many good questions, guys. I'm trying to figure out which ones I want. Ooh. Okay. So this person asked, does anyone have any experience with the Limb Innovations Infinite Socket? How about the Martin Bionic socketless system? I have the VA approvals finally, but I need to decide on a socket. Okay, so, adjustable socket technology has been a huge buzzword in the community now, and it's been building up now for quite a few years. And yes, I've had actually two of the companies on my show. A few years back, I had Limb Innovations on the show. And for the past 2 years, I've had Click Medical. They are the makers of the Revo Fit system. And I actually have a sample of one right here. Hang on. Here we go. Okay, so what is adjustable socket technology? It's in the name itself right there. So it basically is creating a way to adjust the volume of the socket. Okay, so those of you who are experienced prosthetic users have learned how to use socks, right? So many of you have understood that during your day, your limb can change in volume. It can swell up and it shrinks down, right, throughout the day. And this is a process that for many people stabilizes over time, right? But even for people who have very stable limbs throughout the day, they can have these little fluctuations. So you have to take your leg on and off, put socks on, take socks off. And we had a question about socks that I'm going to get to in just a moment, right? And that can prove to be, kind of a pain in the tushy, right? To have to keep doing that, especially people who fluctuate up to 10 ply socks a day, right? So enter the adjustable socket, right? And there's a couple of things, couple of entities out there in the industry right now that provide an adjustable socket technology solution. So the two biggest players, because there's several, but the two biggest players right now are the Martin Bionic socketless socket and the Click Medical, which is the one that I have here. Okay. I will be very honest, guys. I don't have as much experience with the Martin Bionic socket. I've had a couple of patients with it, and the people who use it seem to be happy. In order to use those sockets, you have to go to a clinic that is specific for Martin Bionics, right? So it's a clinic that's owned by Martin Bionics, and their prosthetists are specially trained to make those kind of sockets, right? So if you happen to live near one, that's something that you can just look into and see if it's the right fit for you. The Click Medical, like I said, it's my personal preference that I like to recommend. I came across this particular company a couple of years back because you all brought it to my attention. Many of you were using the Click Medical adjustable socket. So I started asking around my viewers and even some of my local patients who were already using it. And then I started kind of hunting around through some of my favorite prosthetists throughout the United States to see what their thoughts are. And overall, very, very positive response. Okay. So there's a couple of different ways that you can have adjustability built in. And let me just explain how this works because a lot of people don't quite understand how this system works, right? So your prosthetist makes your socket. They still make the socket. They order a little kit, right? And this is actually this box. It's the green box, right? They order a kit. Inside this kit brings all the materials and tools that they need to build the adjustability into the socket, right? And obviously, this company has also a lot of training programs that your prosthetist can listen to and get trained on how to build the adjustability in. So as you can see, there's a couple of different ways. This is a demo socket, by the way, so it's got a lot of action going on. Okay. So we just put the all right, so this one is called a gap device. So there's a gap and it sits on the back part. And this is usually for the AK right here, or it can be on the back part of a below the knee, right? So you click, twist the dial, and hopefully you can see those cords. You can see that start to tighten up. I really loosened it a lot, okay? So it can tighten and it'll close in. You can see that gap starting to close in, right? You also have panels. So they can build panels into the socket, right? And I really loosened it up so you could see it. You click and twist, and it tightens it up. Typically, you don't have to loosen it that much. I just did it so you guys could see what was going on, okay? So the benefits to having this is obviously you don't have to take your leg on and off. You just tighten it or loosen it depending on what you need for the day. And for the Click Medical, I believe it goes up to 10 ply adjustability, right? So that's quite a bit of adjustability. And usually that will accommodate for most people for throughout their day. Okay. So if you're somebody who normally wears 12 or 13 ply sock a day, this can bring you down to having only to wear 2 ply or 3 ply sock, right? So it's really handy, especially for when you're having a lot of volume fluctuations. All right, I missed a lot of comments, so let me go back here. Okay, so Elaine says, right above the knee, amputee here. I had hip replacement surgery on the left, so on the sound side, and I feel like I've lost so much muscle tone and control since the hip surgery. I have a large area that feels asleep on the outer thigh on the left. Is there an exercise I can do to regain that mobility? Elaine, yes. And this is something that when it comes to hip replacement surgery, that's kind of like the PT 101 orthopedic surgery, meaning any physical therapist who has a bright, shiny new license should be able to do a hip replacement protocol with their eyes closed and their hands tied behind their back. Okay. So the good news is hip replacement surgeries and knee replacement surgeries have become fairly common nowadays, right? Most people are not even staying overnight in the hospital anymore after having these joint replacements done. Okay. It also means that there's any physical therapist, right? Any Bobo physical therapist with a license. And that was kind of mean of me to say that. Any physical therapist with the license can treat this. And yes, you do need physical therapy after a hip replacement or any joint replacement surgery. All right. A lot of these muscles get cut through. Okay, there's a lot of weakness that can be associated. And then if you're an amputee, you really need to get that rehabilitated to get it strong again. So, Elaine, this is something that I would just say you need to go see a physical therapist. When it comes to the area that's falling asleep on the outer part of your thigh, that's something I would also want to bring to the attention of your surgeon. Sometimes you're going to have some numbness there because some of the superficial nerves might have been cut during the surgery, right? So, some of that skin might be a little bit numb and typically it returns. But it depends on how long ago you had this hip surgery. But if you feel like you've lost a lot of muscle tone and you're having some numbness there, I think that's something that you need to bring to the attention of your surgeon just to make sure that there's no nerve damage that's happened in there. So, again, that weakness, again, I can't see you in person, so I don't know your entire medical history. So, I'm just kind of hazarding a guess. But it's either due to the fact that you need to really get in with physical therapy and have them evaluate you to see what weakness specifically that you have and how much you need to regain, right? And then also just to kind of look at that numbness and see where's that numbness really coming from and what's causing that numbness. Is that just normal post-op numbness that you have sometimes on the skin that comes back? Or is it something that they need to look into? Okay. Mhm. So Denise says, my amputation was sudden from an infection that almost took my life. So I didn't have any time prior to surgery. My decision was my leg or my life. And this show has a ton of good info. Thank you, Denise. Read as much as possible. The bigger picture is to take it one day at a time. Surround yourself with a good team that you are absolutely comfortable with, PT and prosthetist. Don't be afraid to speak up if something is not working for you. Lots of good advice. This is why I like asking you guys for the advice because you have way better advice than I do. Denise continues to say there is life after amputation and it can be as good as you determine in your mind it will be. Best wishes. Thank you guys for posting all of these things. All right, let's see. All right, I have. Oh, Marianne, you had sent me a question about the adjustable sockets, and it was related to what I just talked about with the Click Medical Revo Fit. So, Marianne, if you don't mind my sharing, is a bilateral above the knee amputee, and she currently has pin lock devices. Okay, so here's what it means to have pin lock. Basically, the liner, which is that covering that goes directly onto your skin, right? It has a little pin sticking out the end. It looks almost like a little screw. And then you put that screw on the inside, right? And you put it through a little hole at the bottom. Sorry, I'm aiming this the wrong way. You put it through a little hole at the bottom, right? And that allows the socket to be attached to your limb. It's the form of suspension, right? So, one of the questions Marianne was asking me is, can you have an adjustable socket or do you need to choose the pin lock? And then my answer is it's two separate things, right? So the adjustability, right? And this is something I actually cover in my YouTube channel. Ooh, can I give you guys a plug? Because I just did a great video on this one. Oh, doggone it. Okay, I'll post that video later. I'll post that video tomorrow. I did a great video on the difference between suspension and adjustability. Okay, but the basic gist of it is when you're doing adjustability, right, you're adjusting the size of the socket, right? When you're talking about suspension, suspension is how the socket is held on to the residual limb. Okay, so technically it's two different systems, and that's how I keep it straight in my brain. Now, does the adjustability, right? That the more snug your socket fits, it also kind of helps hold that on, right? So some people might call that a part of the suspension system as well. So it depends on who you talk to, right? Okay. So when it comes to adjustable socket, can you have a pin lock? Yes, you can. And actually, sorry guys, I'm trying to make sure I get the right dial in here. Okay. The Click Medical, the company that makes the adjustable socket, they also have a suspension system that works. So it's a mechanical suspension system, right? So this attaches on to the end of your liner and then twist the dial and it gets threaded in. kind of hard to see from here, but I have videos that I'm going to post later on my YouTube channel, guys. If you go to my YouTube channel and go under the 2-minute chat section, I have a couple of videos that demonstrate that. So you can kind of get a good see. Jenny, not weird question at all. She says, what is the front and the back of the socket that you're holding? I know there's a lot of stuff going on here. It's their demo socket. So they kind of put all the different ways that you can adjust onto one socket so I could demonstrate. So this is the front. Okay, so this is actually a right above the knee prosthetic device. So just so you can kind of just visualize, right? It goes like this, right? So outer part, inner part, front, and then back. Okay, so this part right here would actually be right here. So on the back part of the tushy, it's called a gluteal gap, right? And that's the part that for this particular design, it can open and close and adjust. And that's kind of another reason I kind of like the Click Medical system, guys, is because there's a lot of different ways that your prosthetist can build the adjustability into the socket. And I like having choices. So you have a panel design, which is this one, the glute design, which is this one. And then there's another one that's not on here. It's called the hinge design. And it does that. It hinges in and out like that. So if you have like a bulbous limb, something that has like slimmer on top and kind of a bulb at the end, that makes it a little easier to put that in as well and to put the socket on. And guys, we're going to be having Click Medical on the show a lot this year, and they've been on my show several times last year. So if you go to my YouTube channel, you can see all the videos that I've done on adjustability and how it works. Have a look-see. All right, let's see what's going on up here. I know I missed a couple of questions, guys. I missed one on socks. I'm going to get to it. I'm going to find it. Oh, there it is. I knew there was a question about socks and I wanted to answer it. So Mark asked, I have a lanyard socket and am now using multiple ply socks. How do I know too much or too tight using the socks? Really, really good question. Again, this is one of those questions that I answer with my patients first. Like this is one of the very first things I teach them is what is considered to be too much or not enough. Okay. And a lot of this starts with your prosthetist, right? When you are being fit for your socket, your prosthetist is helping you with your alignment to see that you're not bottoming out. Okay. You don't want the bottom of your residual limb hitting the bottom of your socket. That's called bottoming out. And you'll feel it and it doesn't feel good, right? In some cases, you may not be able to feel it, but your prosthetist can do a couple of tests in there to see if you're too far into the socket. So basically, with the socks, it helps elevate you out of the socket if needed. Like if you're bottoming out too much because your residual limb has shrunk, right? And you're sinking too far into the socket, when they put on the socks, it kind of helps elevate you up just a little bit. Okay. So when a patient first comes to see me, I'll call the prosthetist and say, okay, about how many socks did they need? Right. And they might tell me 3 to 4 socks. And I'll go, okay, I know I need to start with 3 to 4. That may have changed in the past 48 hours, right? But I'll start with 3 to 4 socks. I'll put them in it and I'll stand the person up. And the first thing I'm going to ask them is how does it feel? Right? And usually, if you're a new prosthetic wearer, you're just like, well, I don't know. How is it supposed to feel? Right? And I'll ask them questions. Is there any pain? Is there any obvious pain or pressure that you're feeling right now? If so, where? Okay. If there's pain, that's usually my first indication of, okay, we need to either add a sock or take a sock off. Okay. And you can tell, like, if I can't put a finger in there into their socket, then I know it's too tight and I need to remove one sock. Okay. And guys, I don't have any socks here with me. I need to really go to like my local prosthetist office and steal some socks so that I can demonstrate this better. Okay. Your socks are going to have different thicknesses. We call it ply, right? So a 1-ply sock is the thin sock. A 3-ply sock is thicker and it's the equivalent of 3 socks put together, right? So when you're adjusting how many socks, usually I adjust things 1 ply at a time, meaning I'll either add 1 ply at a time or take off 1 ply at a time. Okay. And Mark, things I'm looking at is how does the person feel? right? They should feel snug in their socket, like it's a really well fitting glove. It should not feel strangled. It should not feel like super, super tight, like encased, right? It should feel snug. Now, as a first time user, it's going to be a little uncomfortable. And I expect things to be a little uncomfortable because, I mean, when in your life did you wear something that snug, right? But there shouldn't be any pain associated with it. Okay, so I might have them wear it, do some weight shifting exercises for a few minutes, and then I'll take everything off and look at the skin. Skin's gonna tell me a lot. If their skin is red and hot and popping, then I know we've got some issues going on. And again, probably means that we need to add or take off apply sock. Okay. If there's some pinkness, maybe even a little bit of redness, but it goes away after a few minutes, then I know it's just their skin needs to get used to it and we're on the right track. Okay. There is some guess and check here, guys. This is not a precise science. There's not a formula. There's not an equation. There's not even a protocol or standards of anything like that. It's basically trying on different thickness of socks until we get that fit. Now, when I feel like we have the right fit on that patient with the socks, I tell them, take a mental picture of what this feels like. Okay. This is what it should feel like when you're wearing the right amount of socks, right? So if the person is wearing 4 ply, right, and it fits correctly, I tell them this is what it should feel like because the next day, that same feeling might mean wearing 5 ply socks as their limb changes. Or they might wake up the next day and their limb is a little puffy and they can only put 2 ply to get that same feeling of comfort. Does that make sense, guys? Right? It's a little frustrating. And I'm not going to lie, for my patients coming in, they get frustrated and they're like, why can't I get this? And I go, it's not you, it's the socks, right? It can be a little bit confusing. But once you start to understand what it feels like when your socket fits properly, right? Then you know to say, oh, you know what? It's feeling a little loose. Let me add a sock. Or, nope, a little too tight. Let me take off a sock. Okay. And that can change throughout the day. Okay. In the case of these adjustable sockets, this is where I think these adjustable sockets come really handy because you can really fine tune the adjustment in terms of how, whoops, in terms of how tight or how much you want to loosen it. All right. Mhm. Mm. Yes, Marianne, it is possible to do suction with the socket. Yes, with an adjustable socket. Yes. So suction is another type of suspension. Yes, you can do it. Phil, if you're having any troubles with that, feel free to please email me directly. Okay. And I'd like to be able to help you out with that. Okay. So Kathy says, thank you for talking about the socks. I'm learning how to adjust. Sorry, messages coming in and get it snug. I'm just starting to walk in my first test socket. Now, things I need to kind of cue you guys on when you're first learning, a lot of times folks like to be just a little too aggressive with putting on socks because they think the tighter the better, and that's not necessarily always the case. Remember, you don't want it to feel strangled, right? And then also, if you put too many socks on, you're going to elevate yourself too much out of the socket. And that's not good either. It's a Goldilocks scenario. Not too much, not too little, just right. Okay. Yes, Jeff, definitely. Knowing the bony landmarks on the residual limb and how and where they should sit in the socket is crucial to obtaining a proper fit. Ding, 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 ding. That's Jeff, you're either a clinician or you had a very, very good PT and prosthetist teaching you all of these things. Yes, definitely with the bony landmarks. So, what do we mean by bony landmarks? So, for example, in our below the knee amputees, right? The socket, depending on the kind of socket that they have, should sit a little bit underneath the kneecap or just maybe right up under it, right there, right? So, or perhaps a little bit, again, depending on the socket, guys, right? But depending on the socket determines where that kneecap will sit. So, for my below the knee amputees, I'll say, okay, you see your kneecap? If it's too far in, if you can't see your kneecap, that means you need to put on a sock or two to get it up a little bit. If your kneecap is poking all the way out, that means you're elevated too far up and you need to come down just a little bit, right? And every person's a little bit different with their bony landmarks. So your PT and your prosthetist should be telling you these are kind of things to look for as well as how it should feel. Yeah. Oh, Elaine, that makes my heart smile. Nope, not at all. Not at all, Elaine. Not everyone uses socks, right? Not everyone uses socks. And again, that's something that's dynamic. That can change. There are some people that in the beginning, because they're very swollen still from the surgery and they're still recovering, they may not be using socks at all. And then as their limb starts to shrink, then they need to start adding socks one at a time. Again, this is where communication with the prosthetist is absolutely key. Communication with the physical therapist is also extremely important, right? Everyone's a little bit different with this. But I'm so glad that you're one of my beginner watchers, and thank you for joining this evening. And I hope you'll be joining us for future shows. All right, guys, I'm going to post this one more time. And again, this helps me keep in touch with you guys. Okay. The texting service, it's a very valuable tool. It helps me keep in touch with you guys. I'm going to be starting to do giveaways here also through the texting service. So if you want to be a part of it, I promise I don't spam you. Okay. Just text Cosi Talks the way it's written there, all caps, one word, to that number, and you'll be a part of the service. Also, if you have a chance, check out my YouTube channel. It's under Cosi Talks. A lot of the information that I covered tonight, I've done specialty videos, especially my 2-minute chats. They're kind of becoming one of my favorite features on the YouTube channel. And I have a lot of great information there and a lot of good links there as well. So, Jeff, thank you very much. I don't know what you just posted there, but I'm going to take a look at that later. Um, there we go. Guys, for those of you who joined this evening, especially my clinicians who chimed in, thank you very much appreciated. Next week, guys, remember what I said, Integrum, Oprah, bone anchored prosthesis implant system, right? They are coming on the show. This is going to be a really good show. Those of you who are on my email list, check your emails because I'm sending out something for the free giveaway, and it's going to be some nice giveaways that they're doing. Okay, guys? So you're going to want to check back in. So next Wednesday, 8:30 p.m. Eastern Standard Time. Bring us your questions. We'll bring you some answers. All right, guys, as always, thank you for letting me be a part of your lives this evening. I will see you next week. Same bat time, same bat channel.